Hi, everyone, and welcome. I'm Darcy Wooten. I'm one of the new course directors for the Clinical Foundations course, and I'm going to be giving an overview of what Clinical Foundations will look like and what some of the changes are taking place in light of COVID-19. I wanted to introduce you to Dr. Rena Eddy, who's one of our new course directors, as well as myself. And you know Dr. Savita Bhakta and Dr. Dina Rifkin from last year. Our contact information is listed here. We are extremely excited and enthusiastic to be here, and we're hoping to make Clinical Foundations engaging, exciting, fun, and very high yield learning opportunity for you this year. Our course coordinators are Annabelle Soto for POM 2 and Kara Ayala for PBL 2. Their contact info is here. So what's new, what's different for POM? One of the big differences is that your POM groups are now going to be your PBL groups, and these are going to stay the same throughout the year. We're doing this as a way of cohorting, and so it minimizes the number of people, students, etc., who you're exposed to minimize your risk for COVID-19 exposure. So we will have about 18 groups in total with approximately 8 students. And as I mentioned, these groups are going to stay the same throughout the year. In terms of the actual POM sessions, about half of them will be remote over Zoom and the other half will be in person. When sessions are in person, we will be using larger rooms compared to the rooms that you used previously for small groups like PBL and POM last year. And we will also expect students and faculty to be wearing masks. And I'll talk a little bit more about this in our safety plan. The reason why we're doing half the sessions in person and half the sessions over Zoom is that we are limited in terms of the number of total students that we can have on campus at any given time. And so we're trading off with POM 1 and POM 2 in terms of the number of in-person sessions that we're having for each course. We really listened to the feedback that you gave us from the spring quarter. And when we do have POM sessions that are by Zoom, we're really working to minimize the length and the content that's covered during those sessions to minimize Zoom fatigue. So we're hoping that these sessions will be around 2 to 3 hours. If they do go from 1 to 5, we're working to build in a 1-hour break so that you will have time to turn off your computer, turn off your screen, get some exercise, get something to eat, take a little break from Zoom. In terms of the lectures for POM, these are going to be still from 10 to 12, just like last year, but these will all be by Zoom. We can only have 10 or fewer students in a room at a time, so obviously we can't have the entire class in person for a POM lecture. So all of these lectures will be by Zoom. The thing that I want to highlight is that most of these will be live versus pre-recorded. And the reason for making them live Zoom lectures is that we're really hoping that you ask questions. We're making them interactive. We're going to have breakout rooms. We're going to have lots of participation. And we want to make them engaging and active and not just something that's pre-recorded that you're watching, because we know that you're getting a lot of that in your other courses. So in order to encourage attendance, even though attendance will be by Zoom, we will have 1 to 2 quiz questions at the end of each live lecture. And so you're only eligible to participate in the quiz if you've attended the lecture on Zoom. And if you answer all the quiz questions throughout the quarter after the live lectures and you get 70% or more of them correct, you will be excused from taking the final at the end of the quarter. So this is something that we're doing to really try and incentivize you to attend these live lectures on Zoom and really to encourage participation and engagement. There's two main themes that we're trying to cover in POM 2. So the first theme is advanced clinical skills, and this is broken down into a variety of sessions to enhance and improve and hone your history taking skills. And then the other component is sessions to enhance and build upon your physical exam skills. We are not allowed to have students examine and interview patients in person due to COVID-19, but we still thought that interviewing real patients would be a valuable experience. So we're setting some of that up over Zoom. And then you'll have a lot of physical exam in-person sessions where you get to practice your skills. We're using a lot of simulation models and using the Sim Center a lot and building in some extra practice time for clinical skills. So I think that the advanced clinical skills aspect of POM is going to be really critical, especially because I know that you missed some of these sessions back in the spring quarter. The other theme of POM 2 is introducing you to the concept of health systems. And I've listed the topics here that will get covered either in lectures or in small group activities. And I think that this is going to be very applicable and engaging for you, particularly in light of everything that's going on with COVID-19 in terms of policies and approaches both locally, nationally, and internationally. PBL is relatively similar to pre-COVID. The big exception here is day 2. So day 1 is going to be in person with your group, just like you would before COVID occurred. And we really wanted to prioritize day 1 because this is where a lot of the really rich, challenging, thought-provoking discussion happens when you're sort of trying to figure out your differential diagnosis and what your lookups are going to be. Day 2 is going to be by remote by Zoom, and this was to sort of balance the learning value with the safety aspect, again, wanting to try and minimize the number of students on campus and the amount of time that students spent in person with one another and risk of COVID-19. So this is the balance that we came up with, and we definitely acknowledge that this could change and we could turn both days into in-person days. We could turn both days into Zoom remote days if needed based on everything that's going on. And then just to draw your attention, this isn't related to COVID, but we have a new health equity thread and thread director, Dr. Weena Joshi, and she is, in addition to delivering health equity content outside of clinical foundations, will be updating and modifying some of the PBL cases so that they have a health equity focus, health equity learning objectives associated with them. So just wanted to make you aware of that. This just lists the different PBL blocks for the year and which course directors are assigned to those blocks so that if you have a question or an issue or something comes up with one of the PBL blocks, you'll know the appropriate person to contact, although honestly, you can contact any of us about anything. And then I just wanted to take a brief moment to go over our safety plan for when we do have in-person learning small group sessions. So I already introduced this idea of cohorting where we're going to keep the POM groups the same as the PBL groups, and we're not going to rotate PBL groups like we normally would, really trying to minimize potential exposures. We're using larger rooms compared to the smaller rooms that we used to use to allow for physical distancing. And then we're expecting all students and faculty to wear a surgical mask the whole time when they have in-person small group activities, and masks will be provided when you come onto campus. Because you're supposed to be wearing your mask the whole time, we can't really allow eating or drinking within the small group setting within the classroom. So if you need to get a drink of water or something during your POM or PBL session, we're going to ask that you step outside to do that so that you don't take your mask down within the group setting. We, as I mentioned, we're limiting the number of students on campus on any given day. So this is why we have some sessions that are remote and some sessions that are in person. And then finally, we have a remote learning option for students who have mild symptoms that could be consistent with early COVID. And I'm going to talk in much more detail about that on the next slide. So we want to empower you to stay home if you have mild symptoms that could be consistent with early COVID-19, including things like cough, headache, runny nose, sore throat, fever, etc. We don't want you to come to work or come to class if you have these symptoms and potentially expose other group members. So if you have these symptoms, please be in touch with student health or your primary care provider to see if you should get tested and for medical management. But if you have these mild symptoms and it happens to be an in-person day for either PBL or for POM, and you feel well enough to participate, but you don't want to come in and expose people, you can still participate remotely. And so the procedure would be hopefully the day before you would know this, but if not, just day of is fine. But prefer day before to email your group members, your fellow students, your faculty facilitator, and then the clinical foundation's course directors, and let us know that you have these symptoms, but you are not ill enough that you can't participate and you still want to participate in the small group activity. So your faculty facilitator for that small group will set up a Zoom link for you, and then you will be able to join the group by Zoom, and the group will be meeting in person. You'll stay at home and just participate remotely. This isn't going to count as an absence. It won't count as one of your personal days, but we're really requesting that you just use this for COVID-like symptoms. So if you are just tired because you didn't get much sleep the night before and don't feel like coming in, we would really prefer you to come in and not use the remote learning option for that purpose, because there are so few in-person learning opportunities this year. I think they are very valuable, and we want to encourage you to do them when they're there. But we do at the same time want to allow you to stay home if you have symptoms, so that you don't potentially expose your group if it happens to be early COVID-19 symptoms. And then finally, I'm just going to give a brief update on ACA. So we are hoping that ACA will run the way that it would always run in the pre-COVID era, where every student has a preceptor and you go in person to clinic for your assigned sessions and see patients with appropriate PPE, of course. And for the vast majority of students and preceptors, this is looking like it's going to work well, and that clinics are open again and they're able to accommodate students. There are some clinics, primarily some outside UCSD clinics, that are not able to accommodate students because of COVID-19. So we have right now about 30 students without preceptors, and we are working very hard to find them new preceptors, as well as thinking of creative opportunities like having 2 students work with 1 preceptor, or having students work with the chief medical residents and seeing patients in the hospital in the inpatient setting for their ACA experience, getting some type of clinical experience. So we will keep you updated, but I am very optimistic that we'll be able to find everybody a very interesting and rich clinical experience where they can practice their history taking skills and their physical exam skills. So stay tuned for that, but things are looking good to sort of run per the status quo for ACA. So that is the overview. I just wanted to say you all are awesome. You have been through a tremendous amount with everything that's going on in school, in the world, I'm sure in your personal lives. And so just wanted to acknowledge that and to let you guys know that the course directors for clinical foundations are really here for you for anything any questions, concerns, please let us know. We want to hear what's working. We want to hear what's not working so that we can make things better. So please do not hesitate to reach out with anything. Thanks so much, and I look forward to meeting with you and working with you in person.